All right, so the stream has begun. Hello, everyone, and welcome to another Dental Shadowers virtual shadowing session. Today, we are joined by Dr. Sebro, who is a pediatric dentist. Dr. Sebro, thank you so much for joining us, and whenever you're ready, you can take it away.
All right, my pleasure. So I am a pediatric dentist. I've been a pediatric dentist for going on 6 years? 6 years since I graduated residency. And honestly, pediatric dentistry is the best specialty in dentistry. A lot of other specialties will tell you they're the best. They are incorrect. Pediatric dentistry is by far the most enjoyable specialty. So today I'll just show you some cases. I'll talk about pediatric dentistry, private practice, and some application things to think about when you're applying to dental school, and later when you get into dental school, if you're thinking about specialties, applying to residency. So my path to pediatric dentistry, I've wanted to be a dentist since I was 5. I actually didn't go to pediatric dentist myself. I went to a family dentist who was lovely. His name is Dr. Jones. And in that picture there, I'm 5, and I just joined the No Cavity Club, and I got to choose a toy out of the toy box. And I was so excited, and I was like, oh, this is a cool job. I get to get toys anytime I want. I can touch all this stuff my mom says I can't touch. What's not to like? Then, getting older, realizing that dentistry actually is a good fit for my personality and what my goals are in life of helping people and being involved in the medical field and having the independence to be my own boss. I ended up actually pursuing it. I'm from Toronto. I went to McGill and I majored in anatomy and cell bio. Took my DATs my last year. I took a gap year while I interviewed for dental school, which made it a lot easier, honestly, to schedule school interviews because I wasn't worried about midterms. I got into 7 schools. I ended up going to SUNY Buffalo because it was the closest to home. And honestly, I know a lot of people will tell you this, but I will reiterate this: just go to the cheapest school you go into. All of the dental schools are accredited. They all teach you pretty much the same thing. You are not going to have a greater advantage going into greater debt. Whatever you can do to minimize your debt load is going to be the best decision if you have a choice among schools. During dental school, when I first went into dental school, I actually didn't think I wanted to specialize. I was like ready to be a general dentist, just do a lot of everything. And then we have rotations through the specialties, every school does. When I got to the pedo clinic is when I was like, this is something that I really like. And I actually ended up spending all of my time, my free time in the pediatric clinic. Anytime my requirements were done, if I had a patient no-show or I couldn't get a patient in clinic times, I would hop over to pedo clinic. Some classmates and I actually founded the pedo club at our dental school because there wasn't one before, and got really involved in charity dentistry, mission trips, weekend seminars, Give Kids a Smile Day, stuff like that. I graduated dental school in 2013 and interviewed for a whole bunch of programs, and I matched to Temple University Hospital, which is where I did my specialty. So then after residency comes the real world. So I moved to New York with my now husband, then boyfriend, got a job was terrible, quit my job, and actually was commuting back to Philly from New York 3 times a week while I was looking for a new job. And that's a long commute, it's about 2 hours one way. Started working in Connecticut, we got married, moved to Connecticut. I always knew that I wanted to open my own practice, even before getting into dental school. So in preparation for that, picked up a job in a distant suburb, so there would be no kind of overlap in patients. And then I started a scratch practice in Wilton, where I am now, in June 2018. So these are just some pictures of before and after for construction. So rewinding back to getting into dental school. So obviously GPA is really important. It just keeps getting more and more competitive to get into dental school as years go by. So if you can keep your GPA up, that's important. But more and more schools are looking for a well-rounded person, which means that you have to try to build a good relationship with professors. I would try to do this a couple years before you have to apply. So if you are applying in your junior, senior year, by sophomore year, if you know you're going to apply, you should kind of try to pinpoint a professor that you feel like, okay, this person knows what kind of student I am, they know my ambitions, I can kind of build that relationship. It doesn't necessarily have to be, at least when I applied, which is a long time ago, to be fair, didn't necessarily have to be like a science professor, like a biology professor or a chemistry professor. I think I got a recommendation from an immunology prof. I got one from some social science and somebody else. It was a long time ago. But the real key is that they're able to write about you specifically, and they're not just writing some generic, like, Jane Smith is a great student and she shows up to class every day on time and she's completed all her homework and she got an A, because that's not really a compelling letter. You want someone who can write a letter about you as a person. So take your DAT early enough to allow for a retake if you need it. If you're really hell-bent on getting in on a certain cycle, take it early. The DAT is a stressful test. I took mine once, but if you take it and you're not happy with your grades, like with your score, just take it again. You can take it 3 times, I think, before you have to write for special permission to take it again. But hopefully, your first time is enough. And if not, your second time bumps you up enough that you're able to get a score that you're happy with. And then again, I don't know how it is now, but when I applied, dental school is rolling admission. Use that to your advantage. Get your application in the first day you can, which means when you ask your professors for letters, tell them it's due 2 weeks before it's actually due, because they're busy. They're doing research, they're teaching classes, they're grading. You don't want to have your entire application done and it's just sitting waiting to submit because you're waiting for a professor to submit it to abscess. So push those deadlines a little earlier for them, knowing that they're busy. This also counts for recommendation letters from dentists or other professionals. We're all very busy people running businesses, families, all that stuff. So if your deadline is actually Friday, tell me Monday, because I'll get it in Monday and then you are not stressed out and feeling awkward about hassling me to get it in on Friday. I was on the admissions committee for my dental school in my 4th year, and rolling admission was definitely works in your favor if you get in early, because the later you go, the more people you're being compared against, the harder it is. The first few people who come in, you kind of have a fresh start. It's like, oh, you look good, but you might not look as good compared to 200 other people who are the same as you. So get your applications in early. Residency is pretty similar. I will say, like I said, when I got into dental school, I wasn't 100% sure that I wanted to specialize. I actually didn't think I did. Even if you go in knowing you want to specialize, that is not something I would necessarily advertise freshman year of dental school. It's going to put a target on your back. Definitely, if you know for sure in your heart, I'm going to be an orthodontist, that's great. Just keep that to yourself and focus on getting the grades needed to specialize in ortho or oral surgery or whatever your specialty might be. Because at the end of the day, unless you grew up in an office of the type that you're trying to specialize in, you don't really know the day-to-day of dentistry because you haven't experienced it. And so it's really important to keep an open mind when you get to dental school. You're going through all the rotations so that you have a little taste of what everything is like, and you might be immediately drawn to something. You might not be drawn to something until 3rd or 4th year. So if you feel like you might want to specialize, but you're not sure, your goal is to keep an open mind and keep your grades as high as possible to give yourself the options. When you find a specialty, or if you find a specialty that you really like, then, show interest, talk to the professors, talk to the department heads, spend as much time as you can there without neglecting your graduation requirements. Dental school is a time crunch. You have to do a lot of stuff in a little bit of time. So time management is going to be huge. And you don't want it to be that you're spending time where you like to be at the expense of your grades, because then you're not going to get in anyways. So, spend as much time there, get good relationships with the department chairs. Honestly, at Buffalo, everyone was really, really friendly. Like anybody who showed interest in a specialty, the department heads in that specialty were very welcoming to you spending extra time asking questions, learning more stuff, like observing when the residents would do more complex cases. And it was really nice. Specifically about pediatrics, community involvement and volunteer opportunities are a great way to gain experience and comfort with dealing with parents and kids, because a lot of pediatric dentistry is dealing with parents. The kids are your patients, but the parents are the ones who are giving consent, who are going to influence how the kid feels about the dentist, how they feel about your office. And so being able to manage that relationship is a skill that is very hard to learn. And it's something that takes practice. It takes practice to be confident when a parent is asking, are you sure you know what you're doing? You know you're sure, but somebody second guessing you in front of your patient can be a little off-putting. So being able to, in volunteer opportunities and community outreach opportunities, kind of practice that skill of like being sure, or at least portraying that you're sure, is actually really useful. Now with COVID, things are a little different with being able to go and observe in person. Hopefully, herd immunity and things past, externship opportunities will return. But basically an externship is you go there for 4 days to a week in the clinic with the residents, and you're seeing the actual day-to-day ongoings of residency programs. I did a bunch of externships, and it was really helpful to see the different types of programs, like the more academic ones, the more clinic-based, the more hospital-based, and kind of see what program I thought would be a good fit for my personality. And again, same as dental school, submit your application early. Request your recommendations early. Every single person in your class is going to be requesting recommendation letters. So if you have a big class and there's only this many professors, get in there early. So just a quick summary of pediatric dentistry. We are primary care providers for children and adolescents. That makes it a little different than a lot of other specialties. A lot of other specialties are not primary care in which they're seeing people routinely. For the most part, like oral surgery, you're going because you specifically need something done by an oral surgeon. Orthodontics, you're going specifically because you need braces and orthodontic adjustments and things like that. Pediatric dentistry is primary care for children. We are seeing routine visits, cleanings, checkups, even if nothing's wrong, for children and adolescents. It's 2 years post-grad. I think there are a couple of 3-year programs where you get a master's, but for the most part, it's 2 years after dental school. And it focuses on growth, behavior development, and behavior management. And often we are the first people to notice something's wrong in a kid, both dental and otherwise, because we're seeing them so frequently. Even a pediatrician past about 2 years old, you only go once a year for a well visit, but you're still going twice a year to the dentist. So that's 3 opportunities for a medical professional to see a kid. And I've definitely caught a lot of things where I have to refer them back to the pediatrician, like, hey, this needs looking at, this might need some addressing. And we work really closely with pediatricians to ensure the health of our patients. So why pediatric dentistry? It's the best, the most fun. You get to hang out with cute kids all day. You get to teach a whole new generation of people not to be scared of the dentist. That's something I hear at my practice every single day, is parents going, I wish my dentist was nice. Or like, I wish I had this experience, because now I'm terrified when I go to the dentist and this kid climbs in the chair and is like, high fives, happy to see you, wants to come back. And I didn't have that experience as a child. So that's something that's really gratifying, is to teach children that dentistry is just a normal thing. It does not have to be scary. We focus a lot on preventive treatment and anticipatory guidance, which is nice. You can kind of head off problems before it's a big thing for the most part. Adult dentistry, sometimes you might get someone who hasn't been to the dentist in 10 years. And I don't even want to imagine what that looks like because I don't treat adults. For the most part, kids haven't had that long to neglect what's going on in their mouth. So you can kind of get in on the ground floor and help parents establish good habits early. It's a fast-paced day. I'm an impatient person. I like things to go fast. Kids are also pretty impatient. They have very short attention spans, so it matches really well. I rarely have a patient in my chair for more than 40 minutes. That's a long appointment for me. We just get in, get out, and it's great. And kids are so funny. They say the funniest things. They're just happy to be here. They make the funniest observations. It's just an enjoyable day. So people think that, I'm only dealing with crying kids. No, but 95% of my patients are like this, leaving happy with a prize in their hand, ready to go play, go home, go see grandma, whatever. The misconceptions about pediatric dentistry, and this is not just by the general public, but in general in dentistry, a lot of people think we work on crying kids. The kid is really going ballistic. I'm not trying to do work on them because, one, my work's not going to be that good if you're moving around. I don't want to do bad work. 2, my goal is to make you have a positive experience. If you're having such a negative experience that I can't redirect that, and make it into a successful appointment, that doesn't help anybody. I'm not having a good time, kids not having a good time, parents not having a good time. It benefits nobody. People think we only see difficult cases. For the most part, I just see healthy kids with clean teeth, maybe a cavity here or there, but not really. Every appointment is a challenge. No, again, a handful of kids. I might have like one difficult kid a day. And by difficult, I mean they're just scared and we can kind of get them through it, distract and stuff like that. Willfully defiant and oppositional children are very rare. You know, a 3-year-old melting down, they're 3. It's a toddler. Like, what do I expect them to act like a 13-year-old? No. And the biggest misconception is that baby teeth are just little adult teeth. And that is probably the biggest hurdle in communicating about pediatric dentistry with other dentists and with the general public, because people think, oh, they're just going to fall out. It's fine. We don't have to treat them. And really, baby teeth are physiologically different than adult teeth. They have thinner enamel, bigger pulp chambers. Things go from 0 to 60 much faster in a kid and go from no pain to pain much faster in a child. And so emphasizing the importance of treating decay when you find it in the baby tooth is a large part of my job. I get a lot of parents like, isn't it going to fall out? I go, well, your kid is 4 and this tooth doesn't fall out till 12. And people don't remember that they were still losing teeth into 5th and 6th grade. They think about, all I want for Christmas is my 2 front teeth, like 6-year-old. And they think that's it. So a lot of parent education is part of our jobs as well. So an average day, it depends on what kind of office you're in. There's different practice styles. There are volume-based practices, which see a lot of patients a day. And I'm talking like some of these places will see 100, 120 kids a day, which is a lot of people. Generally multiple dentists, a very large support staff, lots of assistants, front desk, hygienists, participation with many insurance plans, including state insurance, relies on the volume, because when you have that many insurance plans and that much write-off, you need volume to make up on the back end. Being fast is very important. And they tend to have extended hours, evenings and weekends to accommodate that kind of patient flow. For the most part, when you graduate from residency, these places are usually always hiring because they have a higher turnover, because you kind of burn out working that much volume all the time. Then there's insurance-based, and I would say most private practices fall under this umbrella, where you have maybe 1 or 2, maybe 3 or 4 dentists, medium-sized staff, participate with many insurance plans. You still rely on volume, but not as much volume as maybe a more clinic-based type of practice. And then sometimes open on some evenings, sometimes some weekends, like 1 or 2 Saturdays a month kind of thing. And then you have a fee-for-service, which is much more rare. Usually only 1 or 2 doctors, not in network with any or many insurance plans. So it's just cash up front, and they'll file a claim and the parent gets reimbursed by their insurance company. Higher fees, meaning you can afford to have lower volume, a slower pace, and fewer days open, because you don't need to be open 6 days if you're not seeing 100 some odd patients a day and you need 6 days. Fee for service is great, but it is more rare. I would say a majority of practices probably fall under the PPO model. So my practice is just me. Just one doctor. It's a fresh start. We're still growing. We just added hygienists last year. We just had the patient volume to justify that. And in my area, there's a lower caries rate. It's a very high socioeconomic status area. So parents are generally well educated. So even if there are cavities, I don't see a lot of repeat cavities. Meaning, like, if I have a child who has 3 cavities, then the parents are like, okay, never again. And then I don't really see them have cavities going forward as much, which is gratifying because it means that they're listening to what I'm saying, what I'm teaching, and really taking those changes to heart. So my practice eventually, if you were to choose one of the 3 models, it'd be like PPO, because we do take insurance. And eventually we'll be busy enough for more staff. This is one of my really cute patients. So here are some cases that I selected that I think are pretty indicative of the kind of stuff that we see in pediatric dentistry and what really makes it pediatric versus just a little kid going to a family dentist. So this child, at the time of this X-ray, was 9, and we got this X-ray sent over from his previous dentist because it had just been taken, so it didn't make sense to retake it. So you can see that arrow is pointing to the permanent canine, and you see it's kind of angled there. It's crossing the root of the lateral incisor. Now, at this point, generally what we would do is extract the primary canine and let it drop into place. However, this child also had some other crowding and other bite discrepancies. And so I wanted to make sure there was an orthodontist on board with this case before I just started extracting teeth, because you don't really want to extract teeth without a general plan. So I told mom, I go, hey, this is really important. Make sure you go to the orthodontist ASAP so we can address this. Because at this point, even though it is crossing the midline, extracting that canine, the primary canine, would give it a good chance of being able to drop down, or maybe like extracting it and having some expansion in conjunction with it with an orthodontist would give it a good chance of coming down relatively simply. Well, mom did not go to the orthodontist when I referred her. She waited a few years. So 3 years later, this child was seen by the orthodontist and a new panel was taken. And now you can see that that canine continued growing, and now it is covering both incisors, lateral and central, and it's approaching the midline. The thing is, now this canine has a much longer route. It's traveled so much farther. This case is a lot more difficult. Now he is in an expander, and he is going to have oral surgery, cut a little window into his into the roof of his mouth to bond a bracket and pull that canine back down. So, this is anticipatory guidance. It's when we find stuff on an early X-ray, we can tell a parent, hey, please follow up on this, because if we do it now, it's much easier. Unfortunately for this kiddo, he's got quite a few years coming in orthodontics to correct the position of this canine. So this case is a little girl, she's 7, and she goes to the family dentist with her parents, checkups, cleanings, everything like that. And, a majority of children in the country do go to family dentists. Statistically, there's just too many kids for them to all see a pediatric dentist all the time. The general dentist on his clinical exam saw that big cavity that you can see. I don't know if you can see you can't see my arrow. I don't think so. Nope. So you can see on the left picture that's outlined in green, that big gray hole, that is visible in the mouth. It's a hole in her tooth. So they took X-rays, and this was in February of 2020. Now, me looking at this case, I can see, yes, that tooth has a big hole, but there's also cavities, 1, 2, 3, 4, 5, 6 other cavities going on here that need to be treated. So he planned a nerve treatment on B, and he had a treatment plan. He also saw most of the other cavities. They didn't come back until November, because obviously COVID happened, March 2020, so things got delayed. And in November, he proceeded to treat that tooth. And then they called our office. It's a general dentist I work with pretty closely. Called our office and said, hey, she really had a tough time with this. She's got a lot of other stuff to do. You guys should see her for the remainder. Totally fine. Happens all the time. She came to our office in January, and we took new X-rays. As you can see, that tooth now has a white thing in it. I really wish you could see my pointer. See if I can make it so you can see the pointer. All right. There we go. So this is the nerve treatment that he did on that tooth. He did a really nice filling on this. Looks great. This filling looks awesome. And you can see the decay has progressed on all of these teeth. So because this nerve treatment didn't remove all of the tissue and there's no full coverage restoration, it's been leaking and causing pain for the patient. So when she came to my office, she was in pain. Next slide. You can see we took another X-ray and the tooth is actually abscessed. That dark area means that the bacteria has absorbed all the bone and that's all filled with pus. And obviously, once it gets to this point, it's an extraction. In an adult tooth, you would do a root canal, but in a baby tooth, when it gets to this point, you're not going to do a root canal because there's an adult tooth under there and you don't want to risk damaging it, trying to take the nerve out and stuff like that. The reason that this case is interesting is that had we seen her here, this probably wouldn't have even needed a nerve treatment. We would have done a crown, some fillings, and she would have been able to keep that tooth. Because the appropriate treatment wasn't done, now she has a missing tooth and she might end up having some space loss and needing some orthodontics in the future. Baby teeth, because they are so much thinner, just decay progresses so much faster. And so a lot of times what we see when we get patients referred from adult dentists is that they have teeth that they were watching. In adult teeth, you can kind of get away with that because the enamel thickness is so much greater and the enamel is physically harder. But in baby teeth, you're just watching it get bigger and kind of watching it become a larger problem. And so a large part of pediatric dentistry is treating so that you can treat a tooth once and minimize the progression of decay. And then this is my third case. And this case was really, really interesting. So I had a 19-year-old female come in for an emergency exam, and her complaint was that her gums were burning. She had just come for her checkup and cleaning, no cavities, beautiful hygiene, X-rays normal, no decay, no bone loss, like no dental reason her gums should be hurting. And she said, it is terrible pain. It is burning, 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 burning. This is not her actual picture. This is just a picture of what it looked like that I sourced. She said it comes and goes, not tied to any particular food, like acidic food, salty food, spicy food, just randomly comes and goes. This clinical appearance of redness around the gums is called linear gingival erythema. This clinical appearance is generally seen in patients who are immunosuppressed or who are HIV positive. Her medical history said that she had a benign osteoid osteoma that had been treated in her knee. Basically, she's a ballet dancer, so she's really in tune with what's going on in her body. And she had gone to the doctor because her knee was hurting and her bone was swelling. And the doctor did a heat ablation to take it away and it never came back. And so they just were like, this is a thing that just happens sometimes. We've treated it a couple of years ago, no problem. So like I said, this presentation is pretty typical of HIV positive patients. This patient didn't have any medical history or social history indicating that she would be at high risk for being HIV positive without knowing. Obviously, you don't know that for sure. So I spoke with her mother and I said, listen, her gums look like someone with HIV. I don't think she has HIV. You haven't reported that. Everything you're saying doesn't make me think that she has contracted this. So something's going on with her immune system. You need to go back to her doctor and tell her or him that her immune system, something's not right. So, and the other thing is that she said, I asked her if the bone pain and the gum pain happened at the same time. And she said, yes, that, they kind of happened within a couple of days of each other. So a few months later, we got a call from a crying mom saying that the further tests, and she was diagnosed with Ewing sarcoma. There are fewer than 200 nationwide cases a year, and she was starting chemotherapy that week. So Ewing sarcoma is a very rare cancer. It's a common childhood cancer, but in general, it is very rare. It presents in patients 10 to 20 years old as bone swelling or intermittent pain, and it is very aggressive. It can spread to lungs, bones, bone marrow, lymph nodes. When caught early, survival rate is 70%, and then after metastasis, the survival rate really drops 15 to 30%. And so it's interesting because it's really important to know that as a dentist, people will always say, oh, you're just a dentist, just teeth, just teeth. But the mouth really does manifest a lot of signs of systemic illness. And because we are seeing people more frequently and are seen as very accessible for emergencies, that kind of thing, you might be the person who finds something like this. Because she's 19, her bones swelled up one time, they treated it, her bone wasn't swelling again. It was kind of achy, but it wasn't swelling again. She thought she was just growing pains, practicing too much ballet, that kind of thing. If she hadn't come in with gum pain and I hadn't recognized that presentation as being an immunosuppressed presentation, who knows how long it would have been until she was diagnosed with cancer. And so thankfully she did come in and she was able to get her diagnosis and start chemotherapy and radiation. I saw her 6 months after, and she was walking and she said nothing hurts, but she was really glad that she came in that day. But overall, I would say it's really gratifying as a dentist, and pediatric specifically, but all dentists I think would agree with this, to be able to help our patients and their whole body health and their whole body wellness. And I think there's been a really great push towards dentistry as part of systemic healthcare and the medical model of dentistry over the past few years in school and in residencies, and recognizing that, yes, teeth are our specialty, but our teeth are attached to a person, and you have to really know what's going on overall in order to be a good healthcare provider. So I just wanted to finish with pictures of my adorable patients, because this is my day-to-day. They just hang out and they're just happy, and we give them lots of toys and stickers and let them have a great impression of the dentist. And it's cool. It's honestly just the coolest job, I gotta say. And if you are interested in dentistry, if you're interested in pediatric dentistry specifically, the American Academy of Pediatric Dentistry is a great resource. There are lots of journal articles that I think are free to access if you're a student. There's lots of social media stuff that they do about articles and teaching parents and really just understanding what's different about being a pediatric dentist versus just a general dentist, and what's different about seeing kids than seeing adults. But overall, my day-to-day is pretty happy and joyful, and I really enjoy it. And then these are just some links to those websites. And then you can always email me, DM me on Instagram. That's my practice, Wilton Pediatric Dentistry, and then my page is at Dr. Ashley. And I post very sporadically because I have a 2-year-old, but I do see my DMs and I do get back to them eventually. So hopefully this was a helpful presentation. Hopefully it was interesting. I know I talk really fast, so hopefully it was interesting. It was easy to understand, but I wish you all luck on your admissions process. I know it's not easy right now, getting your shadowing hours in during COVID and studying and being locked down. So I wish you all the best of luck when it comes to dental school admission, because I can't say if I had to do it again, I would do it again, because dental school is really hard, but I'm glad I did it once. And then I made it through to the end, and it's pretty good on the other side. So
Awesome.
That's the end of my presentation.
Awesome. Thank you so much, Dr. Sebro. That was a very informative presentation. And Shalini will take some questions from the chat now.
Okay.
Yeah, we actually received a few questions for you. The first question was, what made you choose pediatric dentistry over being a general dentist?
To be honest, I don't really like treating adults that much. It's interesting because, again, the misconception is that kids are always whining and complaining and crying. Adults do all that stuff too, to be honest with you. And if you're 5 and you're crying, I get it. If you're 45 and you're crying, I'm a little less sympathetic. Not to say that there's not valid reasons for people being scared and nervous in past experiences, but I just found it a lot more gratifying to work with children in general. And I don't know, I see some of those adult dentist cases that people do, like those amazing smile makeovers. I'm just like, good for you. That seems like a lot of work. And it's like, it's great that you are doing that, but I don't want to do that.
That makes sense.
Yeah.
Our next question is, do pediatric dentists tend to make a higher salary than general dentists, even considering the more loans you have to take out for extra schooling?
You don't necessarily have to take out loans for extra schooling. So residency is paid. in pediatrics, there are some that charge tuition, but a large proportion of them are paid. So I personally did not apply to any that charged tuition because I was like, I'm tired of this tuition business. And I knew I had a strong application. So I only applied to residencies that had a stipend, which ended up being mostly hospital-based residencies. So you're paid on the PGY 1 and 2 scale, same as the medical residents who are at that hospital. Yes, pediatric dentists make more than general dentists. It can be significantly more depending on your market.
Okay, thank you. What was the difference between PPO and volume-based?
Generally speaking, the difference is state insurance. So if you're taking state insurance, meaning Medicaid, generally those fees are very, very, very low. And so in order to make sense, in order to pay like your rent, your staff, your bills, supplies, you have to see way more patients. Like I'll give you an example with like fake numbers. Let's say your cleaning price is normally $100 for a cleaning. Medicaid will pay you $35 or $30. And so in order for you to make $100, you have to see 3 patients to the every one. That's somebody who's making $100 will. Now, if you're a PPO insurance, you might be getting paid $70 or $80, depending on your contracts, your area. And so you have to see 1.5-ish to make that 100. So you still have to do some volume, but it's not as much of a gap that you're trying to make up between, you know, a Medicaid fee, a cash fee, than an insurance fee and a cash fee. Every insurance company is different. Every market is different. In my market, we're able to negotiate our fees pretty well. If you're in a more saturated market, you might not have that opportunity. These are things to definitely consider after you graduate dental school when you're looking for a job. You know, everyone wants to live where it's nice, but that also means that it drives the reimbursement rates down because the insurance company goes, well, I'm not going to pay you 80 if I can pay those 3 people 50. So there's a balance of where you want to live, where you want to work, and how you're going to pay your bills. And that's really something that, unfortunately, as things get more insurance-based, that you have to consider with regards to where your career will be. So, you know, everyone wants to live in Southern California, everyone wants to live in New York City, everyone wants to live, you know, Metro Atlanta, you know, somewhere in Houston, Dallas, Texas, like tons and tons of dentists. And you'll see people opening up practices in a building with 3 other practices. And it's not that it can't be done, but you're choosing a harder path for yourself. And you just have to be ready for that.
That makes sense. I actually personally had a question for you. Since you wanted to start your own practice, how were you able to learn kind of the business aspect of opening up a practice, also learning about all these different types of insurance and things like that that maybe you didn't learn during dental school or undergrad?
That's a really good question. So I did not learn any of that in dental school. You don't have time. The goal of dental school is to get you to competent. And then once you're out of dental school, that's when the real growth begins. Like I said, I knew I wanted to be a dentist since I was really young. And I've always known that I wanted to open my own practice. And so I did a lot of reading. I honestly started reading about dentistry and practice management my junior year of college. That makes me a little bit of a weirdo. I'm not recommending that. I'm just saying that that's when I kind of started. There are CE courses that you can take to learn about insurance billing, about, you know, practice design, like how many chairs you need, how many square footage you need, like how to order supplies in an efficient way. There are resources out there. It takes a lot of legwork. I started my practice June 2018. I started the process of starting my practice September 2017 in terms of securing financing, permits, real estate, leases. You involve lawyers. It's an expensive, long, drawn out process, and it is terrifying. But it's gratifying now, 2.5 years in, to kind of see that it is chugging along and working. But how to learn the business side, just be observant. A lot of what I learned was through my previous jobs. I worked at like 5 or 6 practices before I started my own. And I think you would find that's pretty typical of a dentist who graduates and is in more of a metro area, that you kind of jump around because most people aren't lucky enough to find their long-term job straight out of school. If you are, great. most people aren't. Most people kind of go 2 or 3 places. I also moved states, so it ended up being a few more places. And just being really observant of seeing the practice style. You know, I've worked in volume-based, I've worked in fee-for-service, I've worked in insurance-based, I've worked at a more corporate, I've worked at a family-owned group, I've worked at a variety of things. So I was kind of able to pick and choose what I liked and didn't like from each job to mold how I wanted my practice to be. Because at the end of the day, everyone's going to have a different vision for their practice and what they want out of it. I wanted something where I could come into work every day and not be crazy stressed out. I'm very picky about my work. I wanted to give myself enough time with each patient, you know, and have a pace that was sustainable.
Thank you so much for all the information. That makes a lot
Yeah, no
more
problem.
sense.
Yeah.
Yeah, so another question was, why did you stay in the United States to practice rather than going back to Toronto or Canada?
I got married. Yeah, I got married to an American and we stayed here. That's really it, honestly. If I hadn't gotten married, I would be in Toronto.
Okay, and how do you manage your work-life balance?
So that is a really big thing for me. How do you manage? To be perfectly honest, I work 3 days a week. My office is open 3 days a week. We're not busy enough to justify 5 days a week. And even when we're busier, I probably would max out at 4 days a week, just because dentistry is a very physical job. You know, you're a professional, but it's a manual labor profession. You're hunching, you're using your arms, you're using your neck, you're using your back all the time. And so it is really easy to physically burn out if you're working too many hours. I am fortunate enough that my husband's job has a good salary. And so me working 3 days a week and him working full time lets us, you know, afford our lifestyle. And I mean, I'm not like falling out or anything, but you know, we have a house, we pay our bills, you know, my kid goes to preschool a couple of days a week, but the secret to work-life balance is finding work that pays you enough to work less. And it's not like the PC answer that people want, but a 3-day-a-week schedule with a toddler, it's pretty close to perfect in terms of I feel like I get enough time to be a mom and spend time with her, and I get enough time to be a business owner and fulfill my professional goals and feel mentally stimulated that way, and neither feels out of balance where I'm like, oh my God, so much mom time. Oh my God, so much work time. I don't feel like I'm missing out on either one. And I think were I working 5 days a week like I did earlier in my career before I had kids, it would be a lot more difficult to juggle.
Okay, the next question is, do you have any advice on how to gain more dental experiences, especially during COVID?
As a pre-dental student or
Yeah, that's what I'm assuming.
like shadowing?
Yeah, I guess this is like one example, but DentalShadowers, but yeah, if you have any other
Yeah.
advice.
Well, you know, thankfully, as vaccinations ramp up around the country, it will become a lot easier to get clinical experience. I think reaching out to a dentist in your community and establishing a dialogue with them and just kind of like, you know, I would email back and forth because again, in COVID, running a business during COVID times, especially the cost of PPE right now is obscene. And so it would be very hard to have somebody in my office just observing and have them outfitted safely just because there is such a shortage of things. But as the shortages decrease and things kind of start normalizing, you'll have better opportunities to get into an office. The other thing is that, you know, with social distancing, we're not really having people in waiting rooms and stuff like that. So having an extra body around a patient's kind of might be like, what is happening here? I think you'll probably have a lot better luck after summer once, you know, more people have had the opportunity to be vaccinated and it feels a little safer for you to be in an office setting. But I would reach out and establish a dialogue. But I will be honest with you, all the hours of shadowing, it's ridiculous. When I applied, it was how many hours do you have to do now? We have to do 50 when I was applying.
I think some schools ask for 100 to 150 hours sometimes.
Like, what's the point of this?
Yeah.
That's so dumb. What are you going to learn in 100 hours of standing over my shoulder watching you do dentistry that you're not going to learn in 2 weeks of standing over my shoulder and watching me do dentistry? You're not getting hands on a patient.
Mm-hmm.
So it's not as if you're building practical skills. And dentistry is pretty repetitive, at least in my experience. The patients are different, but procedurally, you're not going to see that much more in 100 hours than 50. I really hope they drop that during COVID, because that's dumb.
Yeah, I think a few schools are being a lot more lenient about it, since obviously it's harder to get like shadowing opportunities. But yeah.
Yeah, the 100 hours. That's too many hours.
I mean, I agree, but yeah.
That's too many hours. I feel bad that that's what you have to do, but yeah, I guess establish a dialogue, and then
Mm-hmm.
how strict are they on checking these hours? Is it just like you have to sign like, hey, you spent 100 hours with me?
Yeah, I mean, I haven't gone through the application. I don't know, Krupa, if you know exactly how you're supposed to log them. But
I think it's mostly based off the honor system, and if they want to confirm, then they'll contact the dentist that you shadowed.
I guess you could do 100-hour-long Zooms with 100 different dentists. I mean, okay, I guess. That's my advice, is wait till the end of summer and see if people are more open to having you in the office, because like right now, mask prices are slowly coming down. Glove prices are obscenely through the roof. Gowns are still expensive. So just like I said, it's kind of hard to have someone in your office using all that stuff, and your staff also has to use it, and you're looking at it like, I have to pay a ton for this.
yeah.
So yeah.
Okay. Do you have any advice trying to get letters of recommendation during COVID? Online classes have made it difficult to get any sort of face-to-face time with professors.
Yeah, so with online class, if there's a participation component where, you're asking questions and stuff like that, I would don't pester your professors, but certainly like follow up with emails if you do have questions, because at the end of the day, they want to see that you're an interested student. You can't really put in the FaceTime as much, but even, again, I went to school a long time ago. Even then, I wasn't like popping up to office hours like, hey, you want some coffee? Let's hang out. No, it was like 5 minutes after the end of class, 2 minutes before class, asking a clarifying question. It was just enough to show that I'm here, I'm paying attention, I'm interested in what you're teaching. And so I don't think that it's impossible to do that virtually, because face-to-face is kind of overrated if in this case, because if you're sending emails and you have a track record of that interaction with a professor, then they'll be like, oh yeah, Krupa emails me questions and they're so intelligent, and we go back and forth. Yeah, I'll be happy to write you a letter. You're clearly a conscientious student. And so I think you can certainly build relationships that way.
So I had a follow-up question for that. Were you able to maintain those relationships with professors after you had taken their class?
I asked for recommendation letters of professors who I was taking their class while I was applying. So I applied during my senior year, and then, had the gap year for interviews. So like my immunology professor, she wrote my letter. I took her classes senior year. She's a really good teacher. I took like 3 of her classes. Biology, I had my lab professor write the letter, because in lab you're in smaller groups, so they can kind of get to know you better. I mean, I don't think that any professors are under the illusion that you're like enamored with them and you're like their biggest fan of life. They understand that you're applying for postgrad, and I have friends who are professors now, and they're like, we really just care that you're a good student. Like, can I write a letter and be honest about the fact that you're an engaging student? Yes, great. They're not like, your favorite color is orange and she always comes in with these highlighters and they're so organized. Like, they're talking in a recommendation letter, they're going to talk about like engaged student, shows leadership, great communication skills. Those are the kind of things they're going to touch on. And so I don't think it's too difficult to demonstrate those qualities in an alternative venue. It's a little harder if you're using professors from previous years who you haven't stayed in touch with. I mean, if you had a really strong relationship with them during face-to-face times, you can always circle back like, hey, remember me? I really enjoyed your class. I'm applying. I was wondering if you'd feel comfortable, blah, 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 blah. But I would make that ask very early, because if they say no, it gives you time to find somebody else.
Okay, cool. Thank you. We had another question. If you get Xray certified and have time, oh, actually, that was a suggestion, I think, for a previous question about what pre-dental students can do, that you can get a job as a dental assistant. So I guess like that answers your question, Christina. Yeah.
Yes. I can't say that I'd hire a dental assistant. I knew that I was gonna grad like even 2 months, because it takes a lot to train. But you could probably find a job as a dental assistant in a more volume-based, like for summer. You could probably do like a summer situation, because if they're ramp up during the summer, or like community health centers would be good. There's a lot of places that do like health screenings, that kind of thing, to get, they need volunteers, check people in, check people out, take vitals. So yeah, that could be an alternative way. Getting Xray certified is not that easy though. That person made it sound very chill.
Yeah.
Depends on your state.
Yeah, it depends on the state, I was gonna say.
Yeah, in Connecticut, apparently that test is pretty hard. I've known dental assistants who failed it a couple of times after years of being dental assistant. So if you can get it, great, but
yeah, I think kind of a long process, but yeah. So I also had another question for you. Just in general, what was the transition like between undergraduate and dental school, and how were you able to like cope with that transition?
do you mean, okay, so I can
In
answer
terms
this
of
two
like
ways.
workload or
The
like
workload is
schedule?
3 times as much as undergrad. So I took a full course, 4 courses, 5 courses each semester, full course load, normal, Dental school is a job. Our first class is at 7:45, and our last class ended at 5:30, and you had lunch. So it's not like undergrad where you might have an early class and then a free period, and then you might have a lab, and then you have another free period, and then you have a class at like an evening or whatever. It's all day. So you take 30 credits a year in undergrad. If you're on a 4-year 120 credit program, you take 30 credits a semester in dental school. So it is an adjustment. And then the first 2 years, you're also in pre-clinic. So you're trying to learn how to make your hands do things that they've never done before. And that is a huge, huge learning curve. Doing wax ups and carvings, and, just learning to control your hands doing microsurgery, basically. Because now if you tell me 2 millimeters, I'm like, wow, that's huge. But pre-dental school, 2 millimeters is nothing. But 2 millimeters in a tooth is the difference between a cavity and a root canal. So it's a big learning curve, but your whole class is going through it with you, and professors know that you don't know how to do any of these things. But yeah, you don't have time for like a part-time, like people work in college, you don't really have time for a part-time job. In dental school, like there's just physically no time, because after school you stay in lab practicing your hand skills. So I'd get to school at 7:45 and I'd get home at 7.
And I think someone else asked, did you ever think of specializing in something other than pediatric dentistry?
Before I got to dental school, I thought like being an orthodontist would be cool. And then when I got to dental school and got interested in pediatrics, I was like, oh, okay, cool. And orthodontics is really cool, but it's like the opposite of pediatric dentistry in terms of you don't get immediate results. I have a kid come in, they have a cavity, it's like, boom, cavity's filled, you're done, see you in 6 months. Orthodontist is like, kid comes with crooked teeth and it takes time and you get a beautiful result, but you don't get to see your result for 12 to 18 to 24, whatever amount of time. And I like fast-paced stuff, so it would not have been a good fit for me.
There were also a few questions asking about your undergraduate degree, like what did you major in and minor in? And if that helped you in dental
I majored in anatomy and cell biology. I didn't declare a minor. I took enough credits for an immunology minor minus like 1 chemistry, and I was like, eh. So I just majored in anatomy and cell biology. Did it help? Yeah. I mean, histology was very familiar because that was part of my undergrad, and gross anatomy was familiar because that's part of my undergrad. But I don't really think it makes a huge difference what you major in. If you know how to study and like have effective studying skills, then you'll be fine. Your major doesn't really matter. I can't think of a major that would like give you a leg up. Maybe biochemistry, because biochemistry sucks, but it's really good. No offense to the biochem majors. I bow down to your superior knowledge, but I hated biochemistry.
Yeah, I'm currently taking that class right now, so
it's
I'm
rough.
gonna have to agree with. Yeah, it's pretty rough.
it's rough again in dental school.
Oh no.
Yeah.
And then I think we had one last question. Any tips for reducing stress in dental school?
Healthy tips?
Yeah.
Sleep. Try to sleep. Don't pull all-nighters if you can avoid it. Just try to get a full night's sleep. Find something to do that isn't just going to the bar with your classmates. You'll be doing a lot of that if you partake in alcohol, but reduce the stress? Not really. It's stressful, but it's got an end date, and you kind of just power through, and you realize that your classmates are all going through the same stress. So it's kind of different from undergrad, where you might be feeling stress from one course and your best friend who's in your same year is in a different major. So like your stress doesn't line up at the same time, and your schedules have conflict. In dental school, it's like high school again. It's like one group of people all taking the same class, all taking the same test, all stressing at the same thing. So that kind of helps. Don't get caught up in comparing, like the people who after tests, like, what'd you put for number 5? What'd you put for number 7? Like, don't ignore those people. Just, no, thank you. Like, the test is done. Why are we taking it again in the hallway? Stop. But like, we used to go skiing a lot in Buffalo. We'd go skiing after Wednesday gross anatomy, night skiing at Holiday Valley. We'd go out and party a lot when it wasn't midterm week. Not much to do in Buffalo, though. If you go to school in a cooler city, you might have more options. But yeah, making sure to take care, like getting sleep, eating healthy. Don't just live on Red Bull and sugar, because you're gonna crash. And it's stressful enough without stressing your body out by not taking care of it physically. So that would be my tip.
That's great advice. Thank you so much, Dr. Sebro, and thank you for answering all of our questions and for your wonderful presentation. And I want to thank everyone who joined us today, and be sure to join us tomorrow for another virtual shadowing session. We have a general dentist, so I hope everyone has a great rest of their Sunday, and hopefully we'll see you tomorrow. Bye, everyone.
Bye.